Hi, this is Dr. Scott St. Amour here with RBK Pediatrics and Urgent Care, and we are making this video for you today just to get you prepared for your 4.5-month visit with your child at RBK Pediatrics. So, welcome back to the office for your 4.5-month visit. Just to remind you, we are always around. So anytime you need anything, you don't have to wait for these appointments to come up. You can always call us for anything that you need, and that's 24/7. We have doctors on call overnight. You should just be able to call the office. We get the message, and we should call you back in about 20 minutes or so. Remember, we do have telemedicine appointments available, much easier than coming into the office. Great for a bunch of things, not so great for a bunch of other things, but call us, and if that's an option for you, we'll definitely make that available. Remember, we are a modern medical facility. We are an NCQA certified level 3 patient-centered medical home. We provide full urgent care services. Both offices are open until 8 o'clock at night for walk-ins, same-day appointments, and everything. If you're not sure about something, if you have any questions about anything, call us, and we'll help you with whatever we can. So, what to expect at your visit, 4.5 months old. First, we'll review everything that's happened since the last time we saw you. Any updates, any changes, any other doctors that you've seen, emergency room visits, all of that kind of stuff. As always, the most important thing that we do at these ages is check that weight. You will never leave our office without going through those growth curves. It is by far the most important thing we do, making sure the kiddos are getting enough calories to grow and develop properly. We'll always do a full physical exam, always gentle. Only the necessary stuff. We try to avoid doing anything unnecessary. We follow the American Academy of Pediatrics guidelines for everything that we do. And remember, you're not rushed at the appointment. Our goal is to make sure that we take care of all of your questions and concerns. So make sure you ask us anything that you want. We're not in a rush to get you out of there. We like our patients, and we like seeing you, and we like talking with you, and we like answering all of your questions. So 4.5 months. One of the most important things we talk about at this age is the sleeping. At about 4.5 months, the kiddos are finally developed enough that they can learn from their own experiences. So we can actually teach them stuff, simple stuff. One of the most important things that we can teach the kiddos at this age is how to use their own experiences before letting their emotions bubble up and take control. At this age, they're waking up again in the middle of the night and crying, not because they're hungry like they were when they were newborns, but because they're scared of the dark. They don't have to be afraid of the dark, and we can show them that. Unfortunately, you can't tell kids anything. Kids have to experience things for themselves. So the only way that they learn that they're safe in the dark by themselves is to be in the dark by themselves. So move the crib to a new room, one without mommy and daddy sleeping right there. Get a good bedtime routine together. Do the same things in the same order at the same time every single night. They're learning from their own experiences, so they'll recognize the bedtime routine and start to conk out in the middle of it, which will help you out. But now you're not helping them fall asleep anymore. You're putting them down in that little crib. You're giving them a little kiss. You're turning out the light and leaving the room, closing the door behind you. So they're not used to this, and they're going to get scared in the dark. Now, we know they don't have to get scared, so we don't have to feel like we're being mean to them. They're going to start crying, and now what you do is you just ignore it. You let them get used to the dark, and you let them teach themselves that nothing bad is going to happen to them in there. So you let them cry. You give it 15 minutes. If they're still crying in 15 minutes, that's when you go into the room, you pick them up, you give them hugs and kisses, tell them what a good boy and girl they are. As soon as they're nice and calm, no. We don't want to teach them that you're going to help them fall asleep anymore. So as soon as they're calm, no wasted time, give them a little kiss, put them right back down in that crib, and let them get back to bed. You basically just repeat that process all night long. Every time they cry, you wait the 15 minutes, you go on in, get them nice and calm, right back down, and right back out. This age is the earliest they could possibly learn this, so it tends to be the quickest that they do. We have no bad habits to break. So if you stay nice and strong with this and you don't go in earlier than those 15 minutes, the quick kids will learn this very quickly, and they'll start sleeping through the night for you within a couple of nights. The other big topic of conversation at this age is the starting solid foods. We can start the mushy pureed foods at this age that are thicker than the breast milk and the formula. But remember, we're not starting the actual foods at this age for any sort of actual nutrition. This is for the practice, the bonding, the fun. So keep it simple. I recommend going with the dark green leafy vegetables, the spinach, broccoli, Brussels sprouts. They have a ton of iron and a ton of fiber in them, so they help the kids poop nicely. And I like the bland proteins, mush chicken, mush turkey. I recommend avoiding the sweet stuff, like the fruits. Since we don't need the fruit for any sort of actual nutrition, we don't want to give the kids a taste for that sweet and make them picky eaters earlier than they otherwise would have. We just advise the kids nothing to drink except for the breast milk or formula. That is still by far the best source of hydration as well as nutrition for the kiddos. And of course, we give the usual advice at this age, the diaper care. New foods means more poop. Poop consistency is going to change a little bit. Remember to keep applying those barrier creams and the moisturizers to the diaper area there to prevent any rashes. They're old enough now that you can take them outside, do whatever you want to. Make sure you're talking to them, sharing the world with them, letting them explore, letting them see the world. Well, that's it for the 4.5-month-old visit here. We're looking forward to seeing you when you come on in. So give us a call if you need anything ahead of time. Give us a call for anything you need anytime. I'm Dr. Scott St. Amour with RBK Pediatrics and Urgent Care. Primary care when you want it, urgent care when you need it. We'll see you guys soon.